Hello and welcome back to the Crisp TV. And today is the first day at Crisp 2024 conference, and we're in Mumbai. We're at Orca Hotel. I'm your host, Dr. Abad Khan. I'm an interventional cardiologist practicing in Ghaziabad. And with me today we have Dr. Nihar Mehta. He is a consultant cardiologist at Jaslok Hospital in Mumbai. And he has been exceptional cardiologist and trained outside India also. So welcome, Dr. Nihar.
Hi, thank you. Thanks for having me here.
And first and foremost, tell us that you have seen the working condition in India. Obviously, you're working in India, and you have worked outside of India also. So, what similarities and differences have you seen in terms of interventional cardiology as structural interventions are concerned?
Well, before we start discussing, let me first thank the CRISP organizers, Dr. Ankur, Dr. Rahul, and the entire team for having me here. And it's a pleasure to be part of this. Well, we in India, I think we really find that there is a large value of going abroad and getting trained and things like that. And after getting my fellowship or DNB in cardiology, I thought the same. I said it might be worthwhile going to different parts of the world and seeing practices there. My first stint was in South Korea and Seoul, and I worked in a very wonderful center there. So in the Far East, the practice is very, very scientific oriented, and to so much so an extent that sometimes the patient care, I'm not saying that there's no patient care, but the science is so significant that they go totally guideline oriented and trial oriented. A good thing about them is that they see their own data, their own patients. So a lot of research backgrounds and a lot of good scientific work, a lovely work ethic, good work timings, a good work and home balance. So that was something which I thought was a really good thing in the Far East. I worked for a long time in the US also as well, partly in New York, partly in LA, and while in the US, you have really got such a lovely insurance coverage that the amount of hardware being used, the amount of, the patients don't end up paying for it because the insurance covers most of the things. So as a cardiologist, you're not worried about, you're worried more about the procedure and the outcome as compared to costs and compared to things like that, which is, according to me, one of the biggest things that we face in India. So my longest stint was in Budapest in Hungary, and I had a lovely experience there as well. I think Europe is a bit of a balance between these two extremes, and while they have to still look at cost, they still have a large insurance coverage. So, in general, some things which we've grown up with. These are a small few experiences which I had when I was working in these places. First thing, going to a ward, you see a bed, patients lying there, and you see no second chair or no second couch where anybody else can sit. So on my first few days, I asked a colleague that where is the family member, and the answer was, what family members? So the thing is that in India, I find that this personal touch that we have with our patients, where every patient will have somebody in their family with them, it's something which is so endearing, and so it's so nice to see that this family culture still exists in India. And I really feel that in India, doctors know their patients. Your patient by name. Sometimes the family members, you've been seeing them for a long time. Patients choose to come to you and they treat you literally like God or like their savior. I think that is a fabulous feeling. It's a fabulous kind of a place to be when you're working, and that's why I feel India is like the best place to work. There is a bit of distance between patients and doctors abroad because today if I went to do an interventional procedure in a country like Hungary, patients are not asking, who is this random foreign doctor coming to do a procedure for me? They have that faith that okay, my procedure will get done. But here, they want to see, doctor ka chehra dekh liya, to khush ho gaya,
So it's exactly the answer what we expected. So, he has worked outside also, and he's working currently in one of the best hospitals also. So he has seen both the things. And continuing on that part, the things have rapidly evolved in India also, in structural heart interventions also, as well as in chip coronary interventions. But obviously not at the same pace as the West. what advice would you give to the interventional cardiologist who want to pursue structural cardiology or CTO fellowship? Because then now there is no dedicated programs or fellowship of this kind. So you can start by that what you have experienced.
Actually, that is actually one important reason that I decided to actually go out of India, because it is very tough to get that hands-on experience. Although in India we have large volumes, the sort of training is variable. Now, what does that mean? That means a person trained in Institute A and Institute B, there might be a large difference in the number of patients they've seen, the number of cases they've treated, and the extent of expertise that they have. And sometimes this difference can be a world of a difference. It could be the difference of someone, being successful in a CTO versus someone who has never attempted a CTO in their fellowship. So when you come out as a cardiologist, you need to really introspect. I think one thing we need to do is we don't need to be worried about time. That, I'm already 32 years old and I'm just starting my career. No. Even a couple of years that are invested in yourself to get that one step further of treatment, training is completely worth it, because that is going to be, in the end, it's going to make you the expert. Now, as an interventional cardiologist, you're the last person that the patient is going to go to. After you, there is nobody else for him. So you have to be someone who is so confident and so comfortable with your skills that you can offer everything possible to your patients. So now for this, what I suggest is that, look, we need to spend time on ourselves. It's like an investment, it's like an insurance policy, that spend some time, find out what you're interested in. Like how when we started out, our seniors, they used to do everything. They used to do coronaries, they used to do pacemakers, they used to do devices.
Certainly.
Now the world has gone into super specialty. So you find your niche. Are you interested in electrophysiology? Are you interested in structural heart disease? Are you interested in complex coronary interventions? And train yourself in a way that you can actually become a master at this particular aspect of coronaries or of the heart.
So the important point which he has manifested and which he has absolutely highlighted, that invest in yourself. That is absolutely the goal. And what's your take on this CRISP conference? How have you been? How is a few hours that you have spent in here?
Well, I've just come into the conference since the beginning. We are into the conference 3 or 4 hours, and we have a lovely turnout. We have some very good discussions. The concept of this conference is wonderful. It is very interactive. There's a lot of time for discussion. Looking forward to the next 3 days of good learning and learning from our seniors, learning from our colleagues, and sharing knowledge.
And then file a rapid fire round. You just say yes or no, whatever you like. A system which is government backed versus a private plus public healthcare in India. Which one do you prefer?
Public was private for sure.
So India.
Look in that kind of, yeah.
Wait. So PCI or medical therapy in a stable angina, what will you go with?
So I wish there was an easy answer to that, but PCI would be my knee-jerk reaction.
Good. Tea or coffee?
Coffee, any day.
Okay, great. So then we have Dr. Nihar Mehta, and we'll continue working on Chris TV and for the next person. Thank you so much.